Strokes occur when there is a disruption in the normal blood supply to the brain. This disruption can be attributed to two primary causes: an ischemic stroke or a hemorrhagic stroke. An ischemic stroke occurs when there is a blockage or obstruction in one of the blood vessels that supply the brain with oxygen and nutrients. This blockage can occur due to a blood clot or a buildup of plaque within the blood vessel, restricting or completely halting the blood flow to a specific brain region. On the other hand, a hemorrhagic stroke occurs when there is bleeding in the brain. This bleeding may result from the rupture or leakage of a blood vessel within the brain, accumulating blood in the surrounding tissues and exerting pressure on the delicate brain structures. Both types of stroke can have severe consequences on brain function and may cause various neurological symptoms depending on the affected area of the brain. Strokes affect millions worldwide, impacting their physical and cognitive function profoundly. Strokes can have life-altering consequences. However, many people don't realize that strokes often come with warning signs, providing an opportunity for early detection and intervention. By recognizing these warning signs, individuals can take proactive steps to mitigate the risk and potentially prevent a full-blown stroke. In this video, we will explore 10 early warning signs of stroke that may manifest up to a month before the event. By understanding these red flags, you can empower yourself to prioritize your health and seek timely medical attention if needed. 1. Recurring and intense headaches. One of the most important warning signs indicating an impending stroke is the sudden onset of severe headaches. These headaches, often called thunderclap headaches, are intense and distinguishable from regular headaches or migraines. They can be described as sudden, explosive, and excruciating pain that reaches its peak within 60 seconds. Unlike typical headaches, thunderclap headaches come on suddenly without any known trigger. They can strike even when you are at rest or engaged in non-strenuous activities. The intensity of the pain is often described as the worst headache ever experienced, making it difficult to ignore or carry on with normal activities. People who have experienced thunderclap headaches associated with strokes often describe additional sensations such as pressure, tightness, or a band-like feeling around the head. Symptoms like nausea, vomiting, sensitivity to light or sound, or vision changes may accompany this characteristic pain. The pain caused by thunderclap headaches can be debilitating and persistent. It is important to note that not all severe headaches indicate an impending stroke. However, when these headaches occur frequently, are sudden in onset, and are unlike any headache you have experienced, they should not be ignored. If you experience recurrent, unexplained headaches with severe intensity, it is crucial to seek immediate medical attention. 2. Unexplained fatigue and exhaustion. Feeling excessively tired and drained, even without significant exertion, can be an early warning sign of an impending stroke. While fatigue is a common symptom experienced by many individuals from time to time, the fatigue associated with stroke risk is different and requires attention. In stroke, fatigue is often described as overwhelming and unrelenting, persisting despite adequate rest and sleep. Individuals may feel a profound lack of energy, experiencing a general sense of weakness and heaviness throughout their bodies. This fatigue can interfere with daily activities, making even simple tasks feel exhausting and challenging to complete. What sets this fatigue apart is its persistence and severity. Unlike ordinary tiredness that can be alleviated by taking breaks or getting a good night's sleep, the fatigue associated with stroke warning signs tends to be constant and unyielding. It may also be accompanied by an inability to stay awake during regular daytime hours, leading to frequent episodes of drowsiness or falling asleep unintentionally. If you notice an uncharacteristic and persistent lack of energy, it is vital to investigate the root cause and consult a healthcare professional. 3. Cognitive decline and memory issues. Changes in cognitive function, such as difficulty concentrating, memory lapses, or confusion, may precede a stroke. These cognitive changes can be subtle initially, but gradually become more noticeable over time. Individuals experiencing cognitive decline may find remembering recent events challenging or retaining new information. They may struggle with organizing their thoughts or focusing on previously manageable tasks. Simple tasks, such as following a conversation or completing an everyday activity, may become increasingly difficult. This can lead to frustration, irritability, or a loss of confidence in one's abilities. Language difficulties are also common warning signs of cognitive decline associated with stroke risk. Individuals may experience trouble finding the right words or expressing themselves clearly. They may have difficulty understanding spoken or written language, leading to confusion in conversations or misunderstandings. These changes in language abilities can impact communication and social interactions. Early detection and intervention are crucial in managing cognitive decline associated with stroke warning signs. 4. Transient ischemic attack, TIA. A transient ischemic attack, often called as a mini-stroke, is a temporary episode of stroke-like symptoms. These symptoms may last for a few minutes to a few hours and then resolve completely. While the symptoms may resolve on their own, they should never be ignored. TIAs are warning signs that an individual may be at a higher risk of experiencing a full-blown stroke soon. Seeking immediate medical attention following a TIA is vital, as it can be a warning sign of an imminent stroke. 5. Irregular heartbeat. Palpitations, rapid heart rate, or irregular heartbeat, particularly atrial fibrillation, AFib, can increase the risk of stroke. AFib is a heart rhythm disorder that causes the heart's upper chambers to quiver instead of contracting properly. This can lead to the formation of blood clots, which can travel to the brain and cause a stroke. If you notice any irregularities in your heart rhythm, such as a racing or fluttering sensation in the chest, consult a healthcare provider to assess your stroke risk and explore appropriate management options. 6. Vision impairment. Sudden changes in vision, such as blurred or double vision or loss of peripheral vision, should not be ignored. These visual disturbances may indicate compromised blood flow to the brain, highlighting the need for immediate medical assessment. Individuals may experience difficulty focusing their eyes, seeing clearly, or have sudden vision loss in one or both eyes. Prompt evaluation by an ophthalmologist or neurologist is crucial to determine the cause and intervene accordingly. They can conduct specialized tests to assess visual function and recommend appropriate treatment or management strategies. 7. Dizziness and balance issues. Persistent dizziness, unexplained imbalance, or coordination problems can be precursors to a stroke. When blood flow to the brain is compromised, it can lead to disturbances in the vestibular system, which maintains balance and spatial orientation. One common symptom is a persistent feeling of dizziness or lightheadedness. Individuals may experience a spinning sensation known as vertigo, where the environment seems to be moving even though they are stationary. This disorienting sensation can significantly impact daily activities and may worsen with head position or movement changes. An unexplained imbalance is another warning sign. Individuals may find it difficult to maintain their balance while standing or walking. They may feel unsteady on their feet, as if they are swaying or tipping to one side. Coordination problems may also arise, leading to difficulties with fine motor tasks such as buttoning clothes or writing. These symptoms can be particularly concerning as they increase the risk of falls and accidents, resulting in further injury or complications. It is important to consult a healthcare professional if you experience persistent dizziness, imbalance, or coordination difficulties to determine the underlying cause and evaluate the potential stroke risk. 8. Numbness or weakness on one side of the body. Sudden numbness or weakness on one side of the face, arm, or leg can indicate an impending stroke. This symptom, known as hemiparesis, occurs due to the disruption of blood flow to the affected part of the brain, which affects the motor functions controlled by that region. Please pay close attention to these signs, as they may come and go initially but progressively worsen over time. When a stroke is imminent, the onset of numbness or weakness is often sudden and without apparent cause. It may affect one side of the body, such as the right or left, and can extend from the face down to the arm and leg. Individuals experiencing hemiparesis may notice a tingling or pins and needles sensation, followed by a loss of sense and control over the affected side. In addition to the physical sensations, facial weakness may manifest as a drooping appearance on one side of the face, resulting in an asymmetrical smile or difficulty fully closing one eye. Movements of the arm or leg on the affected side may become challenging or feel weak and heavy. Tasks such as grasping objects or walking may become difficult or impossible once performed effortlessly. It is crucial to recognize these signs and seek immediate medical attention if you experience sudden numbness or weakness on one side of your body. 9. Speech and language problems. Speech difficulties, slurred speech, or trouble understanding others can be warning signs of an impending stroke. A stroke affecting the brain's language centers can result in various communication challenges. One of the common speech-related warning signs is difficulty finding the right words or expressing oneself clearly. Individuals may experience word-finding problems, where they struggle to recall familiar words or substitute incorrect words in their speech. They may find it frustrating to express their thoughts accurately and may rely on vague or incomplete phrases. Slurred speech is another notable symptom. It occurs when the muscles involved in speech are affected by the disruption of blood flow to the brain. Slurred speech may make individuals sound like they are mumbling or have impaired articulation. Others may have difficulty understanding their speech due to the lack of clarity and distinctness. In some cases, individuals may have trouble comprehending spoken language. They may struggle to understand conversations or follow instructions. This difficulty in processing and learning spoken information can lead to confusion, frustration, and social isolation. 10. Elevated blood pressure. High blood pressure, also known as hypertension, is a significant risk factor for stroke. Monitoring your blood pressure regularly and seeking medical advice if it consistently exceeds healthy ranges is crucial for stroke prevention. If left uncontrolled, hypertension can damage the brain's blood vessels, increasing the risk of a stroke. Blood pressure can be effectively controlled by adopting a healthy diet, exercising regularly, managing stress, and taking prescribed medications. Regular checkups with a healthcare provider are essential to monitor blood pressure and adjust treatment as needed. In conclusion, recognizing the early warning signs of stroke is paramount. By familiarizing yourself with these 10 red flags that may manifest up to a month before a stroke, you can be proactive in safeguarding your health and potentially preventing a life-altering event. Remember, early detection and timely medical intervention are key to mitigating a stroke's severity and long-term impact. Please like the video and share it with your friends and family. Hit that subscribe button now and join our community of health-conscious individuals. Together, we can make a difference in stroke prevention.